Case number 5 is a common plantar heel pain presentation with risk factors including activity-specific demands, foot type, and sport-specific footwear. Patient 5 is a female runner with pronated feet and plantar heel pain. This is a typical female presentation. She's around 45 years old and 62 kilos, has an active lifestyle and runs 20 kilometers a week in running shoes. She has a flexible, moderately pronated foot and has functional hallux limitus with a failed Jack's test for sagittal plane function. She's had a painful heel for 6 months and it's causing her to stop running as much as she'd like, and she wants to keep up with her exercise. It's worse first thing in the morning, especially after running days, but warms up when she's running after the first 5 minutes or so. This patient responded positively with fascial support and antipronatory taping. Let's go through the pathway for orthotic prescription. Step 1. Let's pick the DOLA Pro style for this patient. Her running shoes have a removable insole, so a full-length device is ideal, and there's plenty of space, so we'll go with a full-featured DOLA Pro full length. And then based on her body weight and control required, we'll use the softer density Pro 70. Step 2. Let's look at her foot type to see what prescription we need to add to the DOLA Pro shell. The fully reinforced medial arch support of the DOLA Pro will reduce the load and strain on the fascia during loading, stance and propulsion, especially in the pronated foot. And with a moderately pronated foot, we're looking to increase the dose to a more moderate dose of medial orthotic reaction force. To do this, we'll add more rear foot control with an extrinsic EVA rear foot varus wedge. The wedge is thicker on the medial side to tilt the foot outwards and support the pronated foot. The flat plantar surface of the DOLA Pro allows fast and easy application of these self-adhesive wedges. Step 3. Now we need to look at the pathology or tissue stress and see if there's any further prescription required there. With functional hallux limitus, we need to add a reverse Morton's extension. This will plantar flex the first MPJ, improve her windlass and propulsion, which will all help further reduce the load on the plantar fascia. Step 4. Due to her running, we're looking for a strong, durable top cover with high quality look and feel with added moisture wicking properties. So we've chosen the DuraFit top cover. The aim of this orthotic is to provide a moderate dose of medial orthotic reaction force with sagittal plane facilitation and a high-end moisture wicking top cover. So let's take a look at how we're going to make this in clinic. We take the DOLA Pro and the self-adhesive heel raise, just place the heel raise on the back. Great thing about having the stable flat plantar surfaces, they just adhere nice and easily like that, so give you a nice professional look, nice and fast. We're now marking the position for the reverse Morton's extension. This is just going to go from 2nd to 5th. There's also some clinical markings on the bottom surface of the DOLA Pro that you can use to make consistency and the symmetry nice and easy as well. We're just going to grab the reverse Morton's extension pour-on pad here, which can also be supplied from DOLA. We're just going to place that on the dorsal surface of the orthotic and then trim it down. So any overhang through there you can just trim down just to make the grinding a little bit easier later on. We're just going to glue the top surface of the DOLA Pro shell and also the DuraFit cover through here. So this is just with our contact adhesive again, nice and even through here. And then we're also going to grab the heat gun and activate the glue once it's dried, ready for placement. So when we're placing, same with all types of covers, we want to go from the distal end back into proximal and work into that heel cup to get a really nice even finish around there, no creasing or anything like that through the heel. This is where we're going to spend a little bit of time and get a nice professional look. This is really worthwhile spending a few extra minutes and just making sure that that's a really nice kind of lab type finish that we're getting through there. And then we're going to go off to the grinder, and once again with the DuraFit top cover, a lot of the time you won't need to trim it. We can just cut all of the excess off with the grinding wheel as we're going. So nice movements. You can take this as slow as you like. Once you get better, obviously it can be a lot quicker, but this video is just showing you how in a few kind of short movements you can get a really nice professional finish, and then we just fit it into the running shoes so it's all ready for the patient to start wearing.